Welcome all. Welcome to this AimExcellence NRMT question answer discussion. Here we are going to continue in the JQA plus mode. Also in this total discussion you will have an idea about the AVD, audio visual discussion. We are going to give a flavor of that. So the question is, 11-year-old Alex came to you with tremor, rigidity, dementia, dysarthria. On MRI, this image is seen. First ocular findings seen in this condition. So see this particular MRI image. In this MRI image, there is a classical finding, and this classical finding is known as eye of a tiger sign. Eye of a tiger sign. So you easily can figure out which condition it is, because this particular question have been asked before. This is Haller-Warden Spaz disease. Eye of tiger sign. And why it is important that we are pointing the exact area, because right nowadays the areas are given and it can be spotted like where exactly the problem is happening, like giving a numerical points like 1 or 2. We can know eye of a tiger sign, but where exactly it is also very important, so that we can identify the area. And this is actually happening in the area of globus pallidus. Globus pallidus. At times also it affects the substantia nigra. So this is the area where it is happening. Why it is happening? Due to the accumulation of iron. This is the accumulation of iron, and it is actually leading to neurodegeneration. Neurodegeneration. You are seeing the sign of extrapyramidal symptoms out here. This along with the dementia. Dementia is there. There are extrapyramidal symptoms are there. So this is by far the whole how the this particular disease is going to be unfold. This disease have two types. One is classical type, where disease sets in very early, even before 10 years of age. This is a classical sign, and patient eventually die in teens, late teens or mid teens. It eventually dies. Why they die? Not because of the disease. The cause is pneumonia. Pneumonia. Most common cause of death in this kind of condition is pneumonia. So we understood there is a problem, and this particular disease is known as Haller-Warden disease, but this is the earlier name. Nowadays it is known as pantothenate kinase associated neurodegeneration. Associated neurodegeneration. Also known as neurodegeneration in brain with iron accumulation 1. So we understood what is happening. There is some problem in pantothenate kinase or pantothenic acid. So some problem is with vitamin B5. Vitamin B5. We know vitamin B5 is actually precursor of coenzyme A. It is actually precursor of coenzyme A, which is associated with energy production and also lipid metabolism. Energy production and also lipid metabolism. So it is actually, these are the areas which is going to be defective, and that is leading to this iron accumulation. What is the importance of this 11 years out here? In the classical type, generally by 10 years disease happens. And by the late 10, the child dies. We already have talked about it. And in the atypical type, it generally happens a little later in the teenage, atypical type, and they die little later. Now, it is important to know, is there is any inheritance pattern? Is any inheritance pattern? Yes, there is also inheritance pattern. It is autosomal recessive inheritance. This can also, the question can ask from here also, hit this angle, inheritance pattern. And it is due to the autosomal recessive inheritance. And the culprit gene is the short arm of chromosome 20. Here there will be missense or null mutation. Missense or null mutation. So, is there any treatment out here? There is one treatment is being postulated, that is phosphopentothenate. Pantothenate. It is not curative yet. Most people die in their teens, but the median age is 11.18 years plus minus. This is the standard deviation factor. This is a PSM angle, 7.8 years. Now the question out here, which is the first ocular finding? The first ocular finding. Now we understand there is neurodegeneration going on, so it is affecting retina, and it will lead to retinitis pigmentosa like syndrome. Retinitis pigmentosa like symptoms, and the first symptom in those cases are night blindness. Night blindness, eventually it will lead to tunnel vision, but the first ocular symptom will be night blindness, and that is the answer of this particular question. This is the way the AVDs are planned, that it is not only going to give you the answer of a particular question, it actually covering all the angles from that particular topic the question can be answered. And we generally have shared till now few AVDs I've already uploaded earlier, but apart from that we generally share JQA and JQA plus mode, and we are going to continue to upload those mainly because we cannot upload all the AVDs. But and there is a little bit of difference between F2F and AVD2. There are three conditions there apart from Wilson and few others which can mimic actually this kind of presentation, but these things are going to be told in detail in F2F. Their important findings, how to distinguish in between them, those are the things that are going to be told in F2F only. And hope you like this kind of presentation. If you like this presentation, if you find this worthy enough, please send your feedback in our Facebook page, message boxes. And if you have any query, just please put it there. We are going to answer it within 72 hours. We are really glad that we are getting encouraging reviews from not only pan India but also from the overseas, and obviously it encourages us to upload few videos, and hopefully you are liking it. If you are liking it, please let us know. It will actually give us the that motivation to upload few more. Thank you for being with us. Thank you for supporting us. Be with us. Thank you.